Here's 5 minutes of questions.
Okay. Thank you, Dr. Bright, for being here today, and I just want to tell you that my family, my community, and myself, we appreciate your 25 years of focused service, specifically when it comes to addressing pandemic outbreaks. And it's my understanding that you've spent those 25 years leading teams of scientists when it comes to drugs, diagnostics, and vaccine development. And we appreciate that. When an administration or decision makers prioritize politics over science, does that tend to increase or decrease the likely results of the loss of life in the middle of a pandemic?
I believe the scientists are best equipped to understand how to manage a public health crisis, and I believe scientists should lead.
And therefore, to my question again, I'll phrase it differently. If the scientists are not leading and the politicians are leading with the final decisions when trying to address the issues of pandemics that are taking people's lives, that way of handling it, does that likely increase the loss of life, or is it likely to decrease the loss of life?
I believe the scientists leading will actually increase the likelihood that we can survive this pandemic and move through it. So if scientists are not allowed to lead and speak up, I believe it could increase the loss of lives.
Thank you. How many times in your career have you personally actively said, I need to enact my right to be a whistleblower?
Sorry, could you repeat that?
How many times in the last 25 years have you decided to enact your right to be a whistleblower?
This is my first time, sir.
Okay, I knew that answer was simple, and I think I confused you because I made it so simple. And the reason why I want to say that is because I believe that you've been incredibly consistent in your willingness to dedicate yourself, your expertise, and your career to saving lives. Is the loss of life on your mind? Was that on your mind when you decided that you needed to enact your right to be a whistleblower?
I've spent my career focused on saving lives, and sir, everything I've done to come forward now is to raise awareness of challenges we have, things that are not getting done, because I do think it will save more lives.
Okay. Are you aware of the fact that the lack of testing in the United States of America is affected by many pieces of the puzzle in order for people to get testing, whether it's swabs, whether it's N95 rated equipment for the caregivers to be able to enact safely with the public? Are those all factors that have contributed to our lack of having adequate testing in America?
They are factors, sir. I don't think anyone has thought through the entire plan completely to understand those critical components for testing. I think there's a lot of confusion about the different types of tests, and I think our national narrative is focused on a number of tests, and it's not about the number so much as the right types of tests, and Americans know how to use them and what they do with that information. And no one has really thought through the raw material supply chain to make sure we can sustain the need to test.
Okay, that sounds a little confusing from somebody who actually has been working at a high level of the United States government in this space that we're discussing at this moment. So my question is, if we're not implementing in this pandemic to the degree or ability that the United States should or could, what's contributed the most to that? Was it the lack of scientists recommending up the chain of command, or was it the people at the top of the chain of command deciding to do things differently than the scientists are strongly recommending?
There's evidence of scientists raising concerns about shortages and other actions that are important to take that were not being taken. It's a different level. In my personal situation as the leadership at HHS, and I asked for Dr. Cadlick, that I believe was dismissive of the early warnings that I was raising.
Okay, and you said early warnings, and despite the early warnings, have there been other examples where warnings and strong recommendations were either being ignored or set aside and other actions were taken?
So I believe that I've learned of others. I mean, the CDC's written several guidelines for reopening America and getting people out of their homes and back to work, and I'm not sure if all of those guidelines have been reviewed or being publicly considered at this point. So there's another example of, I think, really hardworking career scientists and their information and their hard work not probably getting the proper vetting and proper exposure to the American public.
Well, one of the things, I have no idea how much time I have, because the clock's been flipping back and forth, but hopefully I have a little bit of time. We've heard boasting from the White House about millions of personal protective equipment, PPEs as everybody knows them as. Millions have gone out to America. But fact, to date, we should have had billions gone out throughout America. Isn't that the disparity?
There's a huge disparity, and healthcare workers are having to compromise their protection and their health and safety because they're having to be creative and reuse a single mask for the entire week or come up with novel sterilization practices that are not proven or tested yet. So that disparity actually is impacting our frontline workers, and those are the people whose lives we really need to preserve so they can treat others.
I have family members who are working in hospitals today on the front lines who have been telling me that they are wearing equipment for days at a time that they're supposed to be disposing of several times a day, and they're having to use them over and over.
Expired.
So thank you very much, Madam Chair, and if somebody could do a better job of the clock, yes, I'd appreciate it. It kept flipping back and forth. I was trying to...
You're absolutely right. It went from, it got stuck at 4:44, went to 0, and popped up to 1:21, so I'm watching too. My father was a watchmaker, clock repairman. Where is Daddy when we need him? A pleasure to recognize Mr. Long from Missouri for his 5 minutes of questions.
Thank you, Madam Chairwoman. And Dr. Bright, you contend that your removal